right, let's dive right in. Today we're going on the trail of a tiny but incredibly powerful global adversary, the dengue virus. You can think of it as an invisible invader that affects hundreds of millions of people. We're going to break down exactly how it operates, how we fight it, and most importantly, how you can stay safe. But to really grasp its impact, you first need to hear one single staggering number. 400 million. The World Health Organization estimates there are about 400 million dengue infections every single year. Just think about that for a second. That's more than the entire population of the United States. This isn't some far-off problem. It is a massive global health reality, right now. So how does something like this even happen? Well, every story has its key players, its villains, if you will. And in the case of dengue, there are two we really need to get to know: the virus itself and the tiny vector that carries it from one person to the next. First up, the virus. Its official name is DENV, and it's an RNA virus. But here's the absolute crucial detail, the thing you have to remember. There isn't just one dengue. No, there are 4 distinct types, or serotypes. Think of them as 4 very similar but dangerously different cousins. And that little fact is the entire key to understanding why this disease can get so incredibly severe. And here is its partner in crime, its getaway vehicle, the Aedes mosquito, specifically the female. Now, these aren't the mosquitoes you might be used to, the ones that buzz around at night. Nope, these are day biters. And they love our cities, breeding in the tiniest pools of clean, stagnant water. Think flower pot saucers, old tires, you name it. A mosquito bites someone who's already sick, the virus sets up shop and multiplies inside her, and then she passes it on to the next person she bites. This is so important. You can't catch dengue from someone like you catch a cold. You absolutely need this mosquito to act as the middleman. So the mosquito bites, and the virus is in. The invasion has begun. Now we're going to look at the battlefield inside the human body, because this is where a really dangerous and, frankly, counterintuitive immune response starts to unfold.
Okay, so let's say you get infected with dengue type 1 for the very first time. Your body, being the amazing machine it is, mounts an immune response. You get sick, sure, but you recover, and you develop lifelong immunity, but here's the catch. It's only to dengue type 1. Your body now has a perfect instruction manual for fighting that one specific virus. But, as we're about to see, that very same instruction manual can be used against you in the future.
This brings us to the most critical, and honestly the most fascinating concept in all of this: antibody-dependent enhancement. We just call it ADE. It is a complete paradox of the immune system. Those antibodies you made from that first infection, they see a new, different type of dengue virus come in, and they try to help. But instead of destroying the new virus, they accidentally give it a VIP pass, helping it break into your immune cells way more easily. Let's walk through this, step by step. You get dengue 1. Your body makes antibodies. You're fine. Then, sometime later, you get bitten by a mosquito carrying, say, dengue 2. Those old antibodies from your first infection rush in and grab onto the new virus, but it's not a perfect fit. The lock and key don't quite match. This clumsy antivirus package then actually helps the virus infect your own immune cells. This leads to way more virus in your body, an insane inflammatory reaction, what we call a cytokine storm, and that can cause your blood vessels to leak, leading to shock. It's a dangerous twist.
So, with all that chaos happening on the inside, what does it actually look and feel like on the outside? How do you or your doctor recognize this invader? It all comes down to decoding the symptoms.
There's a nickname for this disease, and it tells you pretty much everything you need to know: breakbone fever. And let me tell you, they call it that for a reason. Dengue is infamous for a sudden, high fever, a splitting headache, intense pain behind the eyes, and just this debilitating pain in your muscles and joints. The name isn't an exaggeration. It really captures the kind of agony people can feel.
Now, while most cases are awful but not life-threatening, this next part is absolutely critical. You have to know when things are escalating. These are the warning signs of severe dengue. If you or someone you know starts having severe stomach pain, just can't stop vomiting, is bleeding from the gums or nose, especially after the first few days of fever start to go down, that is a medical emergency. It means the body is entering that dangerous phase where blood vessels are starting to leak.
Of course, doctors need to confirm their suspicions, and they do that with lab tests. It's kind of like detective work, and it's all about timing. In the first 5 days or so, they can actually detect a piece of the virus itself, something called the NS1 antigen. After that, your body's response kicks into high gear, and they start looking for your antibodies. First, IgM shows up, which says, hey, this is a new infection.
And later, IgG appears, which points to a past or even a second infection.
Okay, so we've identified the enemy, and we know its sinister tactics. So the big question is, how do we fight back? Well, our arsenal really has two main strategies: treating the people who are sick and vaccinating those who aren't.
And the very first thing you have to understand here is that there is no magic pill for dengue. There's no specific antiviral drug you can take to just kill the virus. All of the medical care we have is what we call supportive. What that means is the entire goal is to support the body's functions, to manage the symptoms, and to give your own immune system the best possible environment to win the fight on its own.
So what does that support look like? Well, for a mild case, it's things you can do at home. Tons of rest, drink plenty of fluids, and take paracetamol for the fever. And, this is so important, avoid aspirin and anti-inflammatories like ibuprofen, because they can increase the risk of bleeding. But for severe dengue, it's a completely different world. We're talking hospitalization, IV fluids, constant monitoring of vital signs, and sometimes even blood transfusions or full ICU care to manage shock.
So what about getting ahead of the game? That's where vaccines come in. For a while, the main one was Dengvaxia. But it's tricky. Because of that whole ADE risk we talked about, you can really only give it to people who've already had a dengue infection. But the newer vaccine, QDENGA, is a real game changer. It can be given to people whether they've had dengue before or not, which makes it a much more powerful tool for public health.
But you know, as amazing as these treatments and vaccines are, sometimes the most powerful strategy is the simplest one. Just don't get bitten in the first place. And that brings us to our final and maybe our most important section, fortifying the gates against the mosquito.
And the great thing about prevention is that it's something every single one of us can do. It starts right in our own homes and backyards. Just once a week, take a 5-minute walk around your property and tip out any standing water you see. In flower pots, in buckets, in old tires, anything. Cover your water tanks, use a good repellent, wear long sleeves, and support your local community cleanup efforts. Every little puddle you eliminate is one less place for these mosquitoes to breed.
And that really leaves us with a final, big-picture question to think about. As our science gets better, as we develop more advanced vaccines and more sophisticated hospital treatments, where should we put most of our energy? Is the future of our fight against dengue found in a syringe and an IV bag? Or is it in the simple, collective, community act of just tipping over a bucket of water? Thanks for joining us.